Okay, so I'm going to show a few different Toy Knot techniques that can be done on any person. And so first, as you have someone prone, you want to pull their arms down on either side to make sure that their body is in a comfortable position. And so that's first you want to kind of check their body. And most people will carry their shoulders a little bit high. You also want to check that their hips and their legs are aligned. Bolster wise, you want to use a bolster as a massage bolster, or I prefer a pillow because it's softer. And since the body's going to be moving in Toy Knot, it's easier if we have a softer pillow under the ankles because it'll be able to move. The bolsters are a little bit more hard. And so this technique is called rocking. So we want to be in a bow stance or a horse stance if you prefer, and you're just going to gently rock the body. This does a couple of different things. It lets you sense where tension is in their body, and it also gets the patient used to the idea that their body is going to move in Toy Knot. So rocking is one of my favorite techniques to do initially. And just get the person used to your hands and used to the movement. Usually you can detect with rocking where their body moves less. And so in this patient, it tends to be her upper back isn't moving as much as her lower back. Both hands stay together in this technique, and you go down the body. You can go all the way down to the ankles with rocking. So we would do this on either side. And then for general purposes, we would go to rolling. Now we've done this before. But again, a bow stance so that your back is straight, your shoulder and your wrist and your elbow is relaxed. You should see her body moving a little bit with the rolling. Okay, so one other technique is pressing that we didn't do. Pressing you can do on the side or at the head of the patient. And so here it's nice to press on the gallbladder points. You can hold that and press, connecting with your feet and the ground. It's just a gentle pressure using the palms of your hands. You can work that down the spine on either side along the bladder meridian. But here you want to coordinate with the patient's breath. Obviously you don't want to make them feel uncomfortable, and so it's just a gentle pressure. So that is pressing. It doesn't move and it's static. If you're going to do deep pressing, you would want to do it on a larger muscle or where there's a muscle knot or scar tissue or immobility of some kind. A lot of times the glutes are going to be easier to work on with deep pressing. So deep pressing you can still do just using your body weight, or you can use your elbow. And so with this, you want to brace the elbow and then deep press into the muscle. And here you can kind of feel any kind of tension melt away. And then you can make the pressure even greater. So that is rocking, rolling, pressing, and deep pressing.